Many of you gathered here 2 years ago to hear the announcement of a very unique partnership for the advancement of healthcare in East Texas. That was a partnership between the Memorial Health System, the Methodist Hospital, and the Temple Foundation. And we're back here 2 years later to tell you about another unique partnership. But before I do that, it's part of the special nature of today is literally this group that's gathered here. The partnership is unique, but to have this group here, not possible to introduce all of you, but I'm going to talk about what groups are here represented. And if you would just raise your hand. But I'll start with with some of our dignitaries. Judge Wes Suter, our county judge, is here. Wes, thank you so much. Our new mayor, Bob Brown, is here. Our city manager, Paul Parker, is here. Head of the Economic Development Group, Jim Wiemeyer's is here. We appreciate all of you coming representing the city. Representing the health system, we have the board of the health system. Our chairman, Jack Sweeney, and vice chair, Yip, is here. And so if you all would raise your hand, that these are representatives of the board of the health system. We have representatives from the Methodist Hospital and the DeBakey Heart and Vascular Center in Houston, several physicians and executives from that organization and the foundation, if you would raise your hands. And we have physicians on the staff for the whole Methodist system. Several of you are here. Dr. Bacciaretti, I know, and others are probably be coming in. And then administrative staff for the memorial system. And then last and certainly not least, organization that helps make all of this possible for us is the board of the Temple Foundation and the executive staff. Buddy Temple, board chairman, is with us at the head table to field questions later. And other board members from the foundation, if you're here. And the executive directors, Wayne. Okay. We're hoping Wayne could join us, and he may still be able to do that. So I told you that initiative 2 years ago that was announced was what we refer to now as the stroke initiative. It was a 3-year program that was funded by the Temple Foundation for a partnership between the Memorial System and Methodist to elevate the level of neurological care, and especially in the treatment of strokes and stroke rehab, stroke disorders. And that's been a fantastically successful program. There were milestones set initially for that program, and almost every one of those milestones have been met, and most of them exceeded, actually. Based on that relationship and that partnership as a foundation, we started working this last year to expand that initiative to the cardiovascular and vascular care. So we've entered into a 3-way partnership to create an initiative. John, if you'll unveil that. An initiative that we will call the East Texas Heart and Vascular Initiative. And the purpose of this, the goal of this initiative is over a multi-year period of time, approximately 3-year period of time. We want to elevate the level of heart and vascular care to all of the patients in the communities that the Memorial Health System serves. And we're going to do that with several parts of the initiative. You can think of the initiative as being mostly education, and we're going to tap into the world-class expertise and training facilities and skill sets that reside at the Methodist Hospital and the DeBakey Heart and Vascular Center in Houston, and bring that knowledge and that expertise here to benefit not only the staff and physicians of our health system, but also the community. And we've got a couple of gentlemen that can tell you more about the program and the value that it's going to create here, and some of the expertise in Houston at Methodist that will be available to us. The first is Dr. David Lattin, who's director of the Heart Vascular Surgery Program for Memorial Hospital Lufkin. Dr. Lattin has been an integral part of putting this initiative together, helping to design it.
Thank you, Gary. Thank you all for being here. I just took a few notes so I don't forget anything.
I'm very honored to be a part of this initiative and to share the stage with Gary Luper, our CEO, Bunny Temple, Dr. Alan Lumsden. Also here is Dr. Mahesh Ramchandani from the Methodist Hospital. What this collaboration will do is to ensure that the people of East Texas will have access to consistent, high-quality care for their cardiac, thoracic, and their vascular needs, and this will be the highest quality of care. This initiative is possible because of the renowned staff and the administration of Methodist Hospital of Houston and the Temple Foundation. This partnership is unprecedented. It represents the combined resources of the Memorial Health System of East Texas, the Methodist Hospital of Houston, as I said, including the DeBakey Heart and Vascular Center, as well as the Temple Foundation with its roots literally embedded into East Texas. Memorial Hospital will be at the forefront of cardiothoracic and vascular health care in Texas. This includes cutting-edge technology, a well-trained, totally professional and caring staff, sophisticated and board-certified physicians and surgeons, and leaders in their respective fields, education programs, screening programs, and national certifications. This is now the reality that exists for our East Texas community, and I appreciate you all. Thank you.
Thank you, sir. Those of you who've had the benefit of family care provided by Dr. Lattin, or personal care provided by Dr. Lattin, know what a unique asset he is for our community. What a blessing it's been to have him here since September of this last year. His beautiful family is here, his wife and daughter Sarah, so good to have you all with us. Thanks for sharing him so much of the time. Also here representing the DeBakey Heart and Vascular Center is the medical director for the DeBakey Center, Dr. Alan Lumsden, native of Ireland, who brought his knowledge, expertise, and skills to Texas a number of years ago. Dr. Lumsden will oversee this whole initiative from the Methodist point of view.
Thank you, Gary. Thank you for the kind words, David. It's my privilege really to represent nearly 120 physicians and scientists who collectively make the Methodist DeBakey Heart and Vascular Center. It represents cardiologists, represents surgeons, anesthesiologists. In addition to this, our support staff and the executives who help make it very successful. As part of that initiative, 2 years ago, we were fortunate to be able to create what we refer to as the DeBakey Institute for Cardiovascular Education and Training. This was funded by another foundation that allowed us to have, one of our goals was to create a world-class education environment. One of the challenges, I think, for physicians, for all of us as physicians, is that when you finish medical school, we finish residency and fellowship, we have to almost relearn our entire armamentarium of procedures every 3 to 4 years. That's the speed at which technology is moving in medicine. And so we don't finish with the tools from fellowship that we're going to finish our career with. And really, the DICET, that's the DeBakey Institute for Cardiovascular Education and Training, is really geared towards how do we help physicians, not just physicians really, all healthcare providers who are involved in a cardiovascular patient, how do we help them and give them the tools to actually train and retrain, because that's kind of the standard of care that we're at. And so it's really, embarking on this initiative is not something that we undertake lightly in terms of choosing to do this and then choosing our partners with it. And indeed, I think that there are just fantastic partners for us in the Memorial Medical System, and particularly in the opportunity to work with David Lattin. You really knocked it out of the park in terms of choosing a physician who can lead it from this end. And we really look forward to pulling these organizations closer and closer and closer together. I would like to take the opportunity to introduce some of the people from Houston who are going to help me make this work. And Mahesh Ramchandani is our Chief of Cardiac Surgery. Matthias Loby heads up, our thoracic transplant program, so heart, lung, LVAD program. David Bernard is the Vice President who helps supervise all of this. And in the front is the guy who's going to be the point person working with me to try and make this work together. And we really appreciate Mike Donovan. He created the training center in Houston and has now come over to do full-time cardiovascular education. So this is the first step in a process for us. We are absolutely delighted to be able to partner with both David Lattin and the Memorial Health System. We are truly grateful to the Temple Foundation for seeing this as a priority. Cardiovascular disease remains the #1 killer in the United States. It's been significantly impacted in recent years, but there's still a long way to go. And I think with this three-way partnership, we can really impact the care of cardiovascular patients here in the East Texas area. But we also see this as a learning opportunity for us. There are things that we're interested in, the research of education. How do we figure out how to deliver a better educational product? And that's what we're going to be able to work together over the next few years. So on behalf of everyone at Methodist, thank you very much indeed for the opportunity to partner with you. We're very excited about it.
Dr. Lumsden, this event is primarily for the media so that we can start the process of telling the whole community. When I say community, we're talking about a number of counties in East Texas that we serve, because this program will eventually reach out into each one of those counties. There will be training for EMS staff, community education training for individuals, very similar process to what we've done with the stroke initiative. It's got some additional benefits to it for folks from this area that need cardiovascular care that we're not able to provide, in that it opens a channel of communications and channels of transfer between our staff here and the very distinguished staff, the world-class staff at Methodist Hospitals, so that care is not interrupted by a lack of communication channels. Those are already set up and will be expanded as a virtue of this program as it goes forward. So we'd invite any of you now to pose questions for any of this group here. We'd be happy to entertain those. It's not a shy group, I know. We know some of you. Mayor Brown, I'll put you on the spot.
I'm just glad that I'm the mayor of a city that is this progressive. I am so pleased with what is going on, and thank you for your vision.
Mr. Wiemeyer, can you imagine that this will help sell this community to those folks that you...
Our healthcare industry here obviously is enormous to the entire community, not only helping us recruit industry, keep the industry we have, but as an industry in and of itself. And through ups and downs, the healthcare industry really has helped steady the ship for this community. I think we all know it. And like the mayor said, it's thank y'all for what you do in the community. It sure is nice to be in a town this size and be able to brag about the kind of healthcare we have in this community.
This project will have an economic impact. We did not attempt to measure that because the clinical impact and the clinical outcomes that we project are far and above enough to justify this program. It's a $3.6 million grant from the Temple Foundation. We've estimated that will fund the services that we project over the next 3 years, which should get us, fairly complete in what we call the initial phase 1 of this education program. It includes mostly educational services that we would access from our partner in Houston, bring here, as well as taking hospital clinical staff and medical staff to Houston to train, get educated in both Mighty and in the DeBakey Institute as well. World-class training programs. Several of us have had a chance to see those, lay hands on them, and they're just unbelievable. So we'll have staff able to go there, as well as I mentioned, community education support for citizens all through this area. It supports the printing of all of the documents and the educational material that we'll need to blanket this whole area to help elevate the knowledge and awareness of cardiovascular disease and how to intervene with that, as well as I said earlier, training even for the EMS staff on how to deal with urgent emergent care.
Dr. Lattin, how is partnering with Methodist going to help the citizens of Lufkin? I mean, what kind of impact is that going to have?
From a standpoint of education, that's one of the things that I'm very excited about. As Alan said, we have to relearn surgery every few years, and it's sometimes difficult to do that, especially when you're by yourself at a hospital. And the laboratory that they have developed at Methodist called the Mighty Lab, M-I-T-I-E. The Mighty Lab is a first-class center. I think it's 35,000 square feet. Under one roof of educational facilities, simulations, computers. where, for example, if I wanted to do, let's say, a endovascular repair of an abdominal aorta, I could take the CD of that patient's films, plug it into the computer, and work on the simulator, do the same exact operation that I will be doing, let's say, the next day or the next week on that same patient. And I could already have practiced it there. This is the type of facility that, you know, a surgeon dreams about, because we always have to keep on learning. As you know, technology is exploding and continues to explode faster and faster. From an education standpoint for my staff, part of my staff is represented here. Being able to train the intensive care unit nurses, for example, bring in some of the Methodist folks from Houston here, send some of our nurses down there to train, to see how they do it at the Methodist, where they do so many of these procedures day in and day out. You know, what we do in a month we think is so busy for this center, which is keeping me very busy. But Methodists may do that in, you know, just 4 or 5 days in 1 week. So from a standpoint of education, like Gary had said, this is the most key thing. And also, having this partnership will allow us to take the patients who really should not be treated at this institution because of the severity of the disease or things that we don't offer here, for example, transplantation, and get them plugged into the system at Methodist, where they could be appropriately treated at a much higher level. So there's very many levels that we'll be dealing with this partnership. But the main thing, as I said, is going to be education. Thank you.
Anyone else?
I have a question. Mr. Temple, why the partnership with TLO Temple and Memorial and Methodist on this project?
We have a long history with Memorial, as you know, and a pretty good history with Methodist. So this was a very natural thing. We were very excited about the prospect of being involved with all of these talented people to bring superior health care to East Texas. That is the primary mission of our foundation, is set out by my great aunt who established the foundation to honor her father, T.L.L. Temple. That was to take care of the people in East Texas who had helped him build his business. The timberlands have been sold and the company's been sold, but the foundation endures. And so we felt this was a wonderful opportunity to fulfill the mission that my great aunt had set out when she established the foundation. I'd like to recognize Jack Sweeney and Tom Darmstetter, who are two of our trustees who were very involved in the formulation of this from our foundation standpoint. Well, they're standing there in the back. So this was right down the fairway for us.
Hey, Dr. Lumsden, why is it important for Methodist to come up here to Lufkin to partner with them?
For us, there's a whole variety of components that are very exciting. Again, what we've done in the last few years is focus on developing this education center. We've always been a big, powerful, progressive clinical operation. What we've really not done is embrace, and very few centers have. In fact, the mighty center at Methodist, there's nothing like that almost anywhere in the United States at the moment. It was modeled after the European Training Center in Strasbourg, and so it's a very unique and progressive way of trying to bring education. And that education is provided in a variety of different environments. Some of it may be, as Dr. Lattin said, come down and use the facilities. But increasingly, it's not that easy to pull busy clinicians like Dr. Lattin down there. So there are now a variety of different ways of remotely connecting into conferences. For example, Dr. Ramchandani runs an ischemic heart conference, which is a very dynamic, interactive conference around complex coronary artery disease with our cardiologists and our surgeons. That's something we would like to connect up here and to offer. And I think there's an opportunity there for us to learn from you. By no means do we think that we have a monopoly on showing all the complex cases. And the more we connect outside the medical center, we find that that's a very much a reciprocal arrangement that we learn from the others. In addition to that, I think that the way the medical center will differentiate itself is continue to provide high quality complex care for very sick patients. But they're not going to stay there. No, these are patients who we need to be able to hand back to the community. And I think someone touched on what I think is the huge Achilles heel in medicine, is that handoff is often not very seamless and not done very well. And we need to figure out how that we make that the transfer in very seamless. We're pretty good at doing that. What we'd be not very good at, we can learn, is what's the best way of transferring that patient back and making sure that we connect all the dots, and we don't necessarily need the patient traveling back to Houston. So there are a lot of process issues that we can learn. What we're also really interested in is how do we deliver that patient education component. That's not something that we've particularly focused on or done particularly well, and I think that this grant from the Temple Foundation allows us to look at that and jointly develop patient education components. And there are several members of our Heart Share Council who are particularly interested in that. One of the things we're going to talk about at lunchtime is you don't function as a surgeon in a silo anymore. I mean, one of our cardiology partners, Bill Zogby, is the current president of the ACC, American College of Cardiology. It's the biggest cardiovascular organization in the world. And they're all about promoting the heart team concept, and that it shouldn't be individual surgeons or cardiologists making decisions, but how do we actually pull them together in the concept of the heart team and choose the right intervention or non-intervention, as the case may be, for an individual patient. And I think these are all things that we can jointly explore together.
Let me add one thing, and what that is, we have focused on vascular cardiovascular surgery today just in some of our comments. But as Dr. Lumsden mentioned, this is going to be a team approach. We have a number of cardiologists, distinguished cardiologists in this community. We're blessed by that, and we already have started some discussions about coming together to help develop a process for elevating care all throughout our health system, using the cardiologist to help us to determine, where do we have gaps in care and where do we need to move to meet a national standard or a world standard, for example. And so through that effort, then we'll be able to determine some of the curriculum that we'll need to access, from Methodist and the DeBakey Institute. Two of those cardiologists have joined us today. I'll start with Dr. Bacciaretti, who many of us think is the father of cardiovascular medicine, maybe even soon the grandfather of cardiovascular medicine here. But he formed the Heart Institute with his partner a number of years ago, and brought on a distinguished group over the years. Dr. Cavalli is here, who's joined that group a number of years ago, and just helped to continue to elevate the level of care. But we'll be involving all of our cardiologists in helping to develop the types of curriculum that we, not only for our staff, but the physicians as well.
Gary, can you talk a little bit about the need for this service in our area? Why do we need this high-end program here?
Well, just drive around, Jackie. What we do know, and I could quote all types of facts and figures, but cardiovascular disease affects all ethnic groups and all populations, in the country. And we know, by actual measure, that the incidence of cardiovascular disease in East Texas is higher than both the state average and the national averages, significantly higher. And so it's not necessarily a function of not having access to services. In many cases, it's not having knowledge about how to intervene in your personal lifestyles, et cetera. And that will be part of this program, is to educate folks about personal lifestyles and how that affects the incidence of both vascular and cardiovascular disease. What we also know is that vascular disease occurs 3 to 4 times as often as cardiovascular disease, and that could be peripheral vascular, in one of your extremities, and we also know that it's a precursor to cardiovascular disease. And so part of this program will be to help develop education programs for the community and local physicians in how to identify vascular disease, so that we can get into the disease states early. And so carrying that back, we know that the incidence of vascular disease in East Texas is much higher than the state and the national average as well. And so the community needs this type of education. Our health system needs that type of education, to take us to level. And Methodist is, as you've heard, it's their mission to expand that knowledge, to extend that knowledge out. And so that's why I call it a unique partnership.
Yeah, if I can add to that, one of the lines we use, you're only as old as your blood vessels. And that's what most of us are going to die from. And so it's this idea of cardiovascular health, and it's the same process that blocks up the arteries in your legs and the arteries in your kidneys and the arteries going to your brain as is going on in the heart. Heart has always been kind of king because of the emotional component of heart disease, but it's really this concept is broader than that. It's really the concept of cardiovascular disease and how do we address that, and that's very much really it's almost non-surgical. This is where it's important to be able to embrace our cardiology colleagues. Indeed, the Heart and Vascular Center is somewhat unique and it's built from 3 departments. It's built from a department of CV surgery, which is our group. It's really got nothing to do anymore with general surgery. The Department of Cardiology, which has got nothing to do anymore with medicine, and CV anesthesia and critical care. So all 3 of those departments are completely focused on cardiovascular disease. And as a surgeon, my colleagues on a daily basis are other surgeons, cardiologists, and anesthesiologists, and intensivists who are working in the cardiovascular arena more than, for example, an orthopedic surgeon or a neurosurgeon. So our entire Heart and Vascular Center is around this concept of disease management stays, and how do we integrate those specialties even more than we have in the past.
Well, we've used a lot of your valuable time, but we think for a good purpose. That's to start here with an education process about what we're about to do now. And so we thank all of you for coming today. Our media reps, we thank you so much. We have local newspaper and television stations represented here, so we appreciate y'all coming and helping to spread this story.